Hello, hello, everyone. Welcome. We'll just take a couple minutes here to get started. Please go ahead and introduce yourselves over chat. Who are you? Where are you coming in from? And we can start there. And then we'll just give a minute or two to let people join and then jump in. For those who are just joining, we're taking a couple minutes to let folks trickle in. Please feel free to introduce yourself, where you're calling in from, where you're joining in from, and then we'll go ahead and get started here pretty soon. Got some Arizona, Indiana, Pennsylvania. Amazing. All right. So for those who are joining in, feel free to introduce yourself. Otherwise, we're going to go ahead and get started. Thank you for joining today's webinar on transforming workplace mental health. We're looking at what it means to operationalize from a mental health perspective. How do you support your employees? How do you shift the approach to mental health from being individualized to being systemically supported within organizations? So within this webinar, we're going to start with a presentation from Meg Hovius and then jump into a panel with some amazing panelists that Meg will be introducing soon. Meg is a workplace mental health advisor and advocate. She is the founder of Here, a consultancy that brings together behavioral experts, organizational designers, mental health advocates, and educators to increase mental health literacy and transform workplace cultures. So I'll go ahead and hand it over to Meg now. And thank you so much.
All right. Hi, everyone. Welcome. And thank you so much for being here. I am going to share my screen. Remember how to do so, and we will get started soon. As McKenna mentioned, I am the founder of Here. We are a workplace, mental health workplace consultancy, really committed to changing minds about mental health. So when McKenna and I connected on this session in particular, I was very excited to dig into this concept of mental health in the workplace and how we can start to really shift that narrative from one of which the focus is sort of solely on the individual to address mental health or find the interventions that work for them, and one that is a little bit more collaborative and allows for space for organizations to understand how they can start to operationalize some of these solutions. So this is a really timely conversation, and we will get into it with starting with, as McKenna mentioned, the presentation, and then we will move into a panel discussion. I am going to try to not take up too much of our time so we can really get into it with our awesome panelists. So give me 1 second as I get us set up. Center. You. All right. Can everyone see my screen? Hopefully we are good to go. Okay, perfect. Seeing some thumbs up. So as we look at transforming workplace mental health and strategies from, again, that sort of individual intervention toward one of organizational success, we've got a lot to cover. And as I mentioned, I'm going to work through this as quickly and comprehensively as possible so that we can really pivot and start to hear from our panelist of experts around how we can address or actions that we can take in regards to operationalizing mental health at work. So we'll look first at the current state of mental health and well-being overall, then the changing landscape of workplace mental health, so how that focus has shifted over the years, and especially sort of pre and post pandemic. The intersection of the foundations of work and core human needs, the importance of fostering culture and really kind of moving toward an environment of anti-burnout and support. And then, as I mentioned, setting us up to hear from our panel on reimagining workplace operations and systems to better support mental health for all employees. So I'm going to assume, since all of us are here on a call to discuss mental health at work, it's likely no surprise to any of us that the US is grappling with a profound mental health crisis that certainly demands immediate attention from a variety of sources, right? From our governing agencies to our community leaders to our workplaces, because we are continuing to see growing rates of depression, anxiety, substance abuse, all of which were on the rise already and then really exacerbated after the pandemic. In 2021, we saw that percentage reach an all-time high at 23% of adults reporting experience with a mental health condition, and 1/3 of adults showing symptoms of depression and anxiety or anxiety. So this statistic is probably also not new to most folks, that 1 in 5 adults do experience a mental health condition each year. But I think it's also important to remember that 5 in 5 adults have mental health. So while you may not be experiencing a mental health condition currently, we all have mental health that we can tend to individually and that we can create spaces to support collectively and organizationally. So that's everybody on this call, right, who has mental health and has the opportunity to create those spaces for themselves, create those spaces for each other, and recognize that we are oftentimes all traveling on a continuum as it relates to mental health and well-being. On one extreme, of course, you have mental illness where well-being is low and you might actually be struggling to function, starting to display behaviors like withdrawal or absenteeism or even addiction, which can all certainly show up in the workplace. And then on the other extreme, you may be experiencing, really high functioning tendencies, leaning into change, leaning into challenges, feeling really energized by the opportunities that you face at work to stretch and learn, and just kind of overall feel emotionally regulated. And then many of us, myself included, fall in the middle of this continuum in sort of the injured or reactive stages. So here you'll start to see behaviors in yourself or in others that look like avoidance, tardiness, maybe a little bit of increased substance use, decreased social activity, so starting to withdraw from some things that may have otherwise brought you joy, or even procrastination. You can see that sort of show up in the workplace. And a lot of the times, these behaviors in particular, as they show up, are often assumed to be personality flaws or performance deficits rather than signs or symptoms of a potential mental health condition. So I bring this up because I think it's important to recognize that we have the opportunity to look out for these behaviors, these actions in a way that could potentially alert in ourselves or with others that there might be something else going on. And then to give ourselves a little bit of that grace and space if we do start to recognize that we're showing up late to things, we're putting things off, that there may be, there may be some things going on that require further exploration beyond just a sense of sort of self-deprecation and assuming personality flaws or professional deficits. Okay, so how does the workplace fit into the conversation? This is a part of what I'm really eager to get into with our panelists in particular, but wanted to just touch on how the workplace really impacts our overall lives and the way in which we show up for work and the way in which we show up for the world. Because the workplace is probably where many of us spend the majority of our waking hours. And it's often the most structured and controlled part of an individual's life, especially for a large portion of that, from your early 20s well into your 60s. You're kind of brought into this environment that has a lot of opportunity to really serve as a primary source of social and emotional support. So this makes the workplace a really critical setting for understanding and supporting mental health. There was actually a study published last year in the Harvard Business Review that I wanted to touch upon because, as I mentioned at the beginning of the presentation, there has been a shift in our overall sentiment as it relates to mental health, specifically in the workplace, as well as the appropriate interventions and how we're thinking about those strategies for sustainable change. In this study, they explored that ever-changing landscape, which was certainly accelerated over the past couple of years, given the global pandemic and navigating that. And really asking workers to report their experience and perspectives around mental health, around stigma, and around the workplace. And while this report showed, and alongside other reports, showed that mental health overall in the US is sort of still maintaining that 1 in 5 statistic, that workers are really demonstrating a greater awareness around mental health at work and are looking to go kind of beyond those traditional benefits and technologies. And what I loved about this report in particular is it was equal parts innovative and kind of bringing it back to our core foundations. Because what they really ultimately found is that workers increasingly want this mentally healthy culture that really meets people where they are and meets those core human needs. So the future of mental health at work won't be an emerging technology or renaissance or a transformation of hybrid of work. The future will be a recommitment to core human needs. So what makes work human? What are those core needs that, when met, can really help transform someone's experience with work? I think it's so important to recognize in this conversation that even though every organization is different, organizations across the country vary in size, they vary in terms of their work policies. Are they remote? Are they hybrid? Are they in person? They vary in terms of what their workforce looks like, manual labor, knowledge work, maybe a mix of both. There are a multitude of ways in which organizations can look vastly different. But for the purpose of this conversation, I think it's really important to recognize and just bring that reminder to light that even with those differences, there are still core foundations that every workplace can really work toward and work to meaningfully address in order to cultivate a mentally healthier workforce. So I wanted to cover a few of those concepts today. We will not get to all of the core human needs, but we'll share some resources that you can dig in. And of course, we'll have a further discussion once we bring the panelists in to answer the moderate questions as well. But first up, of course, is safety or protection from harm. So this includes physical and psychological safety, of course, but also financial stability, balance in the workplace in terms of expectations, in terms of workload, and then figuring out what that sustainability looks like long term. And then autonomy. So really ensuring that employees have the time, bandwidth, and resources to do what they need to do. that they have some level of control over what they're doing at work, what those duties look like, how those duties are performed, flexibility in their working style and flexibility in the workspace, and predictability over their work. Again, is there a gap between what individuals expect they are expected of doing and what they are actually doing? Because when we have that dissonance, when we lack that predictability over our work, it can be incredibly taxing for folks, coming back to that core human need of autonomy and control. And then, of course, having a voice in the workplace, whatever that looks like, whether it's being given the opportunity to weigh in on decisions or to run with a project, really just trying to create that sense of autonomy within the workplace. And then, of course, a classic, a go-to, incredibly, incredibly important for any workforce, big or small, is belonging. So the ability for individuals to really show up authentically at work, to have the opportunity to make meaningful connections, kind of beyond that monthly happy hour or gathering that might be available, to really feel that sense of support and to find community in others. I think if aside from mental health at work, what has become incredibly clear over the past couple of years is our need for community and what that looks like, and the dangers in which loneliness really bring at an individual and a community level. So again, recognizing that the workplace does have this opportunity to meet the moment and create these supportive hubs or supportive communities for people and for their people in particular. So as I mentioned, safety, autonomy, and belonging are really just a few examples of these core human needs. We could spend another 25 minutes just digging into the remaining needs, but I wanted to brush on or touch on a couple that I think are really important for this conversation. For a deeper dive into this concept, into the foundations of sort of core human needs, we're going to drop in the chat the link to the U.S. Surgeon General's framework on workplace mental health and well-being that was rolled out to the US, I believe, in October 2023. And it's just a really great framework if you're starting to explore these concepts at work, if you're trying to understand your workplace and how you could even just organize your own strategies. This is a really good framework to start with. Okay, so we've talked a little bit about just the overall state of mental health and well-being in the US. We've talked about the state of workplace mental health and how that landscape has shifted over the past couple of years, and then more specifically about the getting back to or recommitting to those core human needs. Now I wanted to look at how transformed culture in particular can help to lead to less burnout and sort of lessen that impact of work on mental health conditions overall. So kind of going beyond just that basic understanding of burnout and really looking at the multitude of contributing factors. When we do that, we really start to see how we can transform operations, policies, workflows, expectations in light of a healthier workforce. So when we think about burnout, I think we oftentimes think of the individual outcomes of burnout, right? Depersonalization, emotional exhaustion, these ways in which burnout manifests individually. And while the outcomes are certainly individual, according to Christina Maslach, who has done a ton of research and work around burnout in particular, the solution is organizational. So taking a brief look at the 7 contributing factors to burnout according to this framework, so that we can start to reframe how we think about burnout and those potential solutions. So what do those solutions look like when we move beyond the individual interventions and start to address the contributing factors at an organizational level? So first up, probably the most often considered factor when we're thinking about burnout is workload, right? So, oh, you're burnt out. It means you have too much work. Let's get a little bit of that work off of your plate so that you can be less burnt out. So this is excessive demands, tight deadlines, the growing volume of tasks that can really start to overwhelm either you as a business leader or your employees. And what we found is that this workload, when prolonged, can certainly lead to chronic stress, and then at an organizational level, obviously reduced efficiency, and eventually just sheer burnout and exhaustion. And then next is lack of control, right? So this is kind of getting back to that idea of autonomy. And when we don't feel like we're in control, or don't feel like we have a certain level of autonomy or influence over our work, we can start to feel a little helpless. We can start to feel frustrated. Our motivation starts to diminish, and we start to feel that sort of increased vulnerability to burnout. Insufficient reward, right? So when employees feel that their efforts are not adequately recognized or compensated, it can certainly lead to feelings of undervaluation, reduced job satisfaction, and just general commitment to the work that you're doing. Fairness, right? Or absence of fairness. So perceived inequities such as favoritism or discrimination, unfair treatment, that can all certainly lead to a place of burnout, while also kind of breeding mistrust or disengagement along the way. And then values, right? So a misalignment between an individual's personal values and the organization's goals or ethics. This can certainly create internal conflict and lead to a loss of meaning or job satisfaction. Lack of community. So coming back to this idea of workplace relationships, and when those are not at their best, or when there's a lack of camaraderie or insufficient social support, folks can often feel isolated, feel in conflict, or experience heightened sense of stress and dissatisfaction. And then last but not least, role misalignment. You see this when there is significant disconnect between an individual's skills and their interests and their job requirements. This misalignment can certainly lead to frustration, underperformance, and a sense of being unfulfilled, ultimately leading to or contributing to burnout. Okay. So operations with mental health in mind. What I am eager to really get into and talk through with our panelists is how workplaces can transform their operations to better support mental health by really embedding these concepts into the organizational fabric. So rethinking policies, working toward a leadership approach to conversations around their own mental health that creates a sense of openness and safety, creating and cultivating cultural norms that really prioritize that safety across all levels of any organization. And recognizing, of course, that this shift requires a comprehensive approach, right? Where mental health is not just that individual issue, but it's an organizational one, right? We're integrating core values and practices that will hopefully have a lasting impact both on the individuals that you employ and the organization and performance at large. Okay. So with that, I would love to pivot to the panel discussion so I can step back and we can hear from our incredible lineup of specialists and experts in the space of workplace mental health. So today we have Dr. Jessica DeVento, who is a clinical psychologist and consulting psychologist, who served recently as the global head of mental health for YouTube. We have Anthony Ware, who is the principal and mental wealth strategist at AW Catalyst and founder of Mental Wealth. Thank you so much for being here. And we have Joe Fung, who's the founder and intersectional coach at Intersectional Group. Thank you all so much for being here. I'm really, really excited to explore these topics with you. We've got a lot to cover with a little amount of time, so I am going to jump right in. So Jessica, I would love to start with a question for you as we are talking through and exploring this shift from sort of individual interventions to a more structural or organizational strategies and interventions. In your work that you have done with Google and YouTube, how have you really framed or defined the responsibility of organizations or business leaders when it comes to mental health of their employees?
Absolutely. That's a great question. And luckily, I was working with an executive team who really wanted to do the right thing and really wanted to uphold, people's mental health as a top priority. And when it came down to it, we recognized that some mental health issues or mental illness cannot be avoided. And it was the employer's responsibility, though, to support folks with mental health issues to be able to seek really high quality services that were provided by the organization, as well as reducing barriers of access to care that were in the employer's purview. For example, stigma in the workplace, or allowing flexibility in schedules so that you can access appointments, at an appropriate time. And then most importantly, we really looked at the responsibility of the employer when it came to preventing the root cause of burnout. So what I really liked in your presentation, Meg, you talk about an anti-burnout culture. And it's so different than what we normally see in tech. And it's even different from, thinking oh, we're going to prevent burnout. No, we're going to be anti-burnout. And I really love that framing and kind of wish I used that when I worked there because it really goes deeper and gets into the systemic fabric of the organization for sure, and the way that work is actually being executed.
That's great. Thank you, Jessica. Joe, Anthony, do you have any thoughts on that shift and what that responsibility looks like in organizations that you've worked with or that you've served in the past?
I can go first. So in my experience, both professionally and personally, I think employee well-beings can improve when leaders set a good example. So when we have team leaders who actually showed up the way they are, and it doesn't have to be something that's really big. It could be a small thing. It could start with, oh, today is actually a pretty hard day for me. I have to make these plans for my family, et cetera, et cetera. And so your staff members can feel okay to share some real feelings with the team without, being afraid of being judged or say, oh, that's my personal matter. I shouldn't mention that to my team. Which I will say boundaries are good. So it is important to practice boundary between personal matters and work matters. At the same time, I think with a little practice, leaders can be okay, I think this is an okay thing to share because we're all human beings, because we're talking about mental well-being. And like you mentioned, Meg, the core human needs is we all have struggles, we all have hard times, and we spend a lot of time with our coworkers, and it would be unnatural if we don't mention anything in our lives at all. So when it's appropriate, when leaders actually share how they really feel, what they encounter in their real lives, especially in today's world, it's usually hybrid. So we don't see each other every day in real life. So sometimes that kind of show up and lead by being a good example can really help shifting, the responsibility from personal to organizational.
Yeah, really good point. I think in my experience, it's been kind of a couple pillars to it. Is going back to your 5 of 5 adults have mental health, and it's leadership teams recognizing like mental health is like the foundation of everything we do in business. Outside of our physical health, it's our mental health, and it's the state that changes according to how the leaders shape out the organization. And so with that as kind of the core piece, I think the other two key pieces are communication and trust. So making sure to, like Jessica mentioned, having the policies and things like that, but making sure to communicate that. Like if there's a EAP, like DAP, if there's a program, but the employees don't know about it, then you can't say the program's at fault because you didn't communicate it. And then the third layer of all this is just trust. It's the wraparound of everything. It's like leadership teams doing what they say they're going to do, or follow through with the policy, or a level of confidentiality around things.
I love that. I agree. Trust is so important, and having that consistency in communication and kind of building in that predictability for people so they can start to kind of lower, their guard at work and start to create a sense of safety is certainly important. So I wanted it to explore now, because we've talked about a few ways in which organizations can be responsible for mental health of individuals at work, to kind of better understanding what some of the challenges are that organizations or business leaders face when they're starting to think about how they can shift that focus, how they can move to operational strategies. And if you have any ideas on how leaders can overcome those challenges, that would be great to hear too. So let's start with you again, Jessica, if you wouldn't mind just sharing your thoughts on those challenges in particular.
Yeah, absolutely. It's going to look different for every company, and it's going to look different based on business needs and the extent that you're scaling or that you're growing or having to be really responsive, for example, to external escalations. And, for example, like YouTube, like very negative content that you have to get down, like it can't wait as a business priority. And so it's really about, I think, making sure expectations for high pace of work are really, really clear upfront so that employees can make an informed decision. Because sprints in the business world and in tech really are inevitable. But the reality is you can't sprint a marathon. So what are the buffers that you build in sort of on the bookends of those sprints to give people time off? So if you're up and you have to work, until midnight, can you flex your schedule and start later the next day so that you get adequate sleep and rest and can come back refreshed with a high quality, processing speed and high quality attention span so that you can continue to do high, excellent work. So like an example of something that we did at YouTube, whenever there was like an escalation, like everybody was coming on for this escalation. So people really couldn't detach from work during non-working time, which was leading to increased stress, of course, and risk of burnout. And so we implemented worked with the business to implement a very clear, escalation team, a very small core folks who handled these escalations and brought in appropriate people as needed. And then that rotated through all of the regions. So there was 24-hour coverage and clear handoffs between the regions in order to do that at a global scale. And they saw significant improvements, even just from something like that.
That is a really incredible example of how to really dig into the operations of an organization and understand how to meet the needs and meet the needs both of the business and of the individuals who are doing the work. As someone who's done a great deal of work in electoral politics and campaigns, I can wholeheartedly relate to immovable deadlines and things eventually turning into a complete sprint. And so knowing what we know in that regard, how do you kind of work those things in to alleviate some of that pressure? Joe, Anthony, any ideas or thoughts to share on challenges that organizations face in your work that you've seen similarly the opportunity to overcome those challenges?
Go ahead, Anthony.
Okay, thank you. Yeah, so I tend to work, at least half my business is working with founders. And I think one of the biggest challenges is just the mindset of understanding like their business is theirs. So they can't, like, they're not as big as Google or IBM or whatever, like do what's appropriate for your size, and get accustomed to like experimenting. Like, for example, there's a couple of peers, but also clients that have in the summer they do 4-day work weeks. But to prepare for the 4-day work weeks, they do the work for setting up policies and communication with clients and stuff like months in advance. And the concept of being iterative, I mean, it's all often talked about when product development and sales and marketing and all that, but you can be iterative with this whole concept of integrating and shifting things to make sure that mental health is an operational priority. So that's kind of some of the experience I've seen.
Yeah, I think this is a really good kind of challenge for organizations to practice, just not only as leaders, but also as individual contributors. Because I practice intersectionality. I help people kind of understand the multiple dimensions of how our life and work is intersectional. And I feel like this is actually a really good matter of intersectionality. When we talk about shifting from personal responsibility to organizational responsibility, we're not talking about eliminating personal responsibility. We're only talking about having the organizations as the leader when it comes to mental well-being. So the way I look at it is, I grew up in China, so it's a very collectivism society versus the US is very individualism. And I feel like when it comes to mental well-being, it could be a really beautiful combination of both individualism and kind of collectivism. And we see the organization actually as our community. Like as an individual, we belong to multiple communities and we can find joy and fulfillment at different places. And workplace is one of them. So when we see an organization as a community, including the leaders, we see our staff members as our community members. How do we collectively uplift and take care of our community member? I think once we kind of shift that mindset, so only looking at our staff members as an employee to employee and community member, then we'll be able to shift that, oh, it's an organizational responsibility. So again, it's a mindset shift, but how do we help ourselves to be able to make that shift a little bit more efficiently is how we see our people as our community members. So that's how I see it.
Pardon me while I search for the heart reaction to that one. Thank you so much. I love that idea. And just reiteration of recognizing both the individual responsibility as well as the organizational responsibility and how we can start to see that as sort of one, kind of one charge for organizations and teams through the lens of reframing toward community. With that said, I'm hoping that the takeaway here for organizations and audience members is not to eliminate individual interventions and programs that can certainly also have a great impact on employee mental health, mental health and well-being. But I wanted to talk a little bit more about how organizations can really ensure that their well-being initiatives are not just that sort of check the box activity, but that they're really truly integrated into the culture itself. And we'll start again, Jessica, if you want to take that lead on that one.
Sure, no problem. I think really paying attention to the voice of the employee and grassroots efforts that employees are really passionate about tends to land better and go farther. And a lot of companies now are really leaning into making sure mental health programs and well-being programs are really data-driven, which I love. Definitely looking at the data and kind of seeing where the needs are, where the culture sits, and what employees are really asking for. However, I have seen frequently, I'm not talking about necessarily Google, but other organizations take in the data, but then don't necessarily act on the data, almost like collecting data for data's sake. And then they go and they ask for more data. Well, what happens, not only is there survey fatigue, but it actually increases employee frustration, decreases employee sentiment about well-being programs because they feel like their voice is not being heard or recognized. And so in order to make really informed data-driven approaches, you want to collect that data, but before you ask for it again, making sure you're actually acting on that in a way that's tangible and can be felt by employees. And so, like a method I always use is when I ask for more data, it's like, hey, here's what we actually did the last time that you all gave us data, or here's what we're planning to do, and you can hold us accountable for it in XYZ ways. And anyway, that seems to land a little bit better.
That's great. Survey fatigue is certainly real. I'm sure many of us on this call have experienced that at some point or another. Anything to add, Anthony? Joe?
I'd add what I've seen, and then just from my experience as part of the group when it comes to mental health is why are you doing it? Like, why are you going to implement this in the first place? Yes, I mean, did you just read an article and you got scared of a lawsuit, or did you have something happen with sales, and like figure out why you're doing it, because everything can be a check the box, but the things that truly have a purpose underlying them, then it brings more meaning to it, and it sticks, it lasts longer. I think that's the thing. There's such a I think someone in the comments talked about preventive health, and that's, I think it needs to come in the form of like when these mental health programs too. When you're operationalizing it, you're doing it for the sake of your people who are running your company, who are helping your customers, who are paying so you can stay in business. So some line of that, I think, can eliminate that check the box mentality, because you're just doing it to check the box. It's not gonna last, and it's gonna come out one way or the other in public, and your business is not gonna look good.
Yeah, I wholeheartedly agree with Dr. Jessica and Anthony here. And one thing I will add is that culture does not happen overnight. Like, culture is not a lightly used word. Like, we talk about culture a lot these days, but to truly understand what culture is to understand it does not happen overnight. So as founders, we have this drive and grind to kind of work on whatever we are kind of passionate about. And oftentimes, myself included, will be like, I'll deal with that later, right? And then you say you'll deal with that later over and over. And then a year later, you're like, oh, my mental health is in the pit. I'm not saying that would be too late, because it's always start now than never. But if you truly want to create a culture in your organization that is truly supportive and provide a sense of belonging, then I would encourage folks to start these initiatives as early as possible. I had advised some founders before, and almost everyone struggled to start addressing mental well-being at the beginning because they just didn't see that as a priority. And I'm really hoping people will start to see, this is part of your culture, and culture takes time to cultivate and to maintain and to grow. So that mindset, again, culture doesn't happen overnight.
That's great. Thank you for sharing that. And I think that is a good sort of setup for the question around workplace operations and systems, right? So how can organizations create systems specifically that not only drive innovation and collaboration, which are incredibly important to business outcomes, but also support employee mental health? So starting to see those things as sort of one and the same, rather than a priority decision that has to be made. Dr. Jessica, do you have thoughts on how organizations can create those systems?
Yeah. Yeah, actually building on the last question a bit, before those systems can be created, I know there's a lot of talk about culture and things. And Megan, your presentation, you mentioned safety, and I think trust was also mentioned today. Really, it's that foundation of psychological safety has to be in place for employees to feel like they can speak up and have a voice, and for changes to be implemented where there's not going to be retaliation or backlash if you do a experiment with something and it doesn't work out. To make sure that people feel like it's okay to even talk about this. I gave a talk years ago about, talking about your mental health in the workplace. And number one was assessing, is it safe? Am I safe to do this before you make an informed decision to share your story, to come out about that? And it can be so difficult. And so much of it is looking at systems work of how systemically is toxic behavior in the workplace handled when people are having a negative impact on others. Is it swift? Is it timely? Is it objective without bias? And is it consistent? Is it consistently applied, not just horizontally, but vertically as well? And thinking also about systems work, kind of once you have that established, doing clear sort of needs assessment, doing like a clear discovery, both across cross-functional players, as well as vertically across different levels, from the IC to the managers, to the directors, to the top executives, of what the perspective is on what is getting in the way. And so often the perspectives of the individual contributors are radically different from the top executives. And sometimes it can be as simple as opening up a conversation between the two to actually be heard and seen from each other's perspective. And usually employees can come together to think of their own solutions. So I love to run workshops where you do that and you bring people together and you align on what the problem is, you align on the drivers of that problem, and then people collaboratively come up with a solution to address that problem. And then there's more autonomy and ownership over the implementation of whatever that solution is. If it's just coming from HR, so many people are like, oh my God, another HR intervention. It's hit or miss if it's going to land based on their former experience with HR programs. But when there's more ownership, I tend to see more success.
I think that's a really great example too of meeting that core human need of autonomy, right? Giving individuals the space to come together and solve for challenges that they're facing in the workplace, and to your point, really take ownership of that. That's great. Anthony or Joe, any additional thoughts on how we can start to or how organizations can really create those systems that will both innovate and collaborate, but also prioritize mental health?
Sure, I can go. I think it's kind of like an iteration of Dr. Jessica's input is I really advocate for community agreements. And it's a very kind of a tangible and practical way to get consensus and sort of like community say we're going to do this together, because we already know mental health and mental well-being is not an easy thing to talk about. Like, I don't want to underestimate the hard work organizations face when it comes to mental well-being. It doesn't happen overnight. And it's even harder for someone who's never talked about mental health before to try it for the first time. And I wouldn't be surprised, I mean, until this day, maybe half of the team members have never shared their mental challenges before. So how can we get people get to that psychological safety? So in addition to, leaders doing by setting a good example, another thing is for organizations to put this kind of community agreement or organizational agreement into part of the policy and say, we're here to do this together. We're holding each other accountable. We bring intentionality to this work. We're here to practice non-judgmental. We make sure we communicate with transparency, etc. So all these can be included in this community agreement and make sure it's very accessible for everyone so that you can always refer to it when you really like struggle with sharing, or you are like, oh, I feel so embarrassed. Like, how, I don't know what to talk about. So I think having the community agreement itself is a really good practice for our mental health.
That's great, and can certainly serve as a framework for organizations well beyond just the initial rollout of those norms. Anthony, any additional thoughts?
Yeah, I love that community agreement. It flashbacks to like things I've been involved in with cohorts, and yeah, it makes it easy though. I mean, it's like a good tool. I love that. I think of like two sides of the same coin that are really specific. One, and I'm thinking of these examples because I just read there's an article in the Atlantic floating around about white collar work being mostly meetings. And it quoted a Microsoft study that said like 57% of people in this study were communicating. So in a meeting, doing an email, doing chat, Slack, whatever, Teams. And so when I think of two things are like, let your people work, put in the systems to let your people actually do the work you hired them to do, and then put in systems for people to rest. So the work piece is like, if you have back-to-back meetings, and you're a leader and you're allowing those to happen, then there's a system that needs to be changed, because then people can't actually do work. So that's individual to your company. And then from the rest side of things, it's time off, like making sure people take their time off. There in recent years that people were there was criticizing of like unlimited vacation and PTO. I'm like, I'm not a critic of that. I'm a critic of the people who don't make sure people take at least 14 days off and don't contact them when they're off, because you should have systems in place. And then outside of vacation times, one of the clients I've worked with over the years, again, this is iterative, now have things in place like people can take it's not even a mental health day, it's just like a you day. It's not a personal day. The name has changed, but the substance is the same. Time off, because we're not robots for as much as things want us to be. We're not robots. So allow your people to work. You need the system to support that. And then allow your people to be off, including you, the leadership team. Like, if you can't, it was the old phrase, and I'll close with it, but it's like, if you can't take a day off as a leader because you're needed in the machine and the systems of the work, then you need to review your systems, because you should be able to take the days off and live your life as a full human being.
Yeah, I think that's a really great reminder to use the data that you have available to you. And by data, I don't necessarily mean data, but what are you experiencing as a leader in your own organization, and allow that to kind of serve as opportunity, serve as information, right? And look at how you can pivot based on your own personal experience as a leader. Okay, we have just a few more minutes. And so the last question I would love to ask each of you, it's a two-parter. first and foremost, what is one thing that you would recommend for the audience to take away from today's conversation and action immediately, or let's say immediately-ish? And then the second question, how can people stay in touch with you and find your work?
I love this question, and I'm almost feeling stumped, but because there's just so many little, good nuggets. But I'll just leave one, knowing it's not going to be comprehensive. Really, it's just really consider starting the conversation with your teams as early as possible. You know, even as simple as, what does mental health mean to you? There doesn't have to be personal disclosure there, but trying to set the tone, have the conversation, and what can I do to better support your mental health as a leader? And I think just opening the conversation will communicate to people that it's safe. If you're getting nothing, everything's great, everything's fine and rosy, you might want to check that something's going on with the trust or the psychological safety that may need to be revisited, and then working on that, and then having the conversation again. And then keeping in touch with me, LinkedIn. LinkedIn's the best way. Jessica DeVento Zubin. And I will see you on the flip side.
Thank you. Anthony?
I was trying to think of like some technical stuff to do this, but like I think the core of it is remember you're human. Like start from there, and in that, like, your humanness, figure out what's going on, because everything flows from that. Like your leadership, the organization, your connection to your team, their connection and love of their work. Yeah, it's it's not as serious. It's serious, but it's not as serious. Take the work serious, and don't take yourself serious. Um, and you can find me on LinkedIn and just Anthony Ware or theanthonyware.com. So those are the two spots.
Thank you, Anthony. And Joe?
Yeah, I love the tips. Really, it's like start as soon as possible, recognize we're all humans. And I will add that, again, this is hard work, and recognize, like, out of the gate, say, this is not going to be easy. This is hard, but we can do it. We'll make the whole thing easier. Because that just simple recognition, not everyone is going to get it right from the beginning, will take the burden off. And also recognize that even though it's going to be hard work, collectively, we can do it together. We will make mistakes, and we can acknowledge that. We can make corrections. We can hold each other accountable and still be kind to each other. And I think that will be really important when team works together and focus on mental health, well-being together. And folks can find me on LinkedIn. I think there's a link in the chat, and my email is joe@intersectional.group. So happy to chat with folks.
That is great. Thank you so much, Joe. Thank you to all of our panelists today. This was an incredible conversation. We could have been here for much longer, but really appreciate your insights and what you bring to the conversation around operations and mental health. And with that, I will kick it back over to McKenna, who will close us out.
Thanks, Meg. Thanks, everyone. That was such a juicy conversation. I know that I'm walking away feeling inspired and reflective, and I hope everyone else is feeling similarly. We have a quick poll that's going to pop up in just a moment. If you have a second to answer the questions, the poll is anonymous, so please answer if you have the time. Other than that, we are really excited that you joined us today, and we have our next webinar coming up in September on market trends in October. Apologies about that. In October on market trends in mental health. So thank you so much. Please please come to the next webinar and share, and this recording will also be available. So thank you.